Welcome to a deep dive into the fascinating world of veterinary neurology. Today, we'll explore a groundbreaking study published in Frontiers in Veterinary Science titled Surgical Management of Single-Level Thoracolumbar Vertebral Body Segmentation and Formation Failure Causing Progressive Thoracolumbar Myelopathy in 3 Adult Large Breed Dogs. This research investigates the complex challenges of congenital vertebral malformations in large breed dogs and provides insights into successful surgical interventions. The study focuses on the outcomes of spinal cord decompression and instrumented fixation in 3 large breed dogs suffering from thoracolumbar myelopathy due to vertebral malformations. Congenital anomalies of the vertebral column are more frequently observed in the thoracic spine of small breed dogs like French bulldogs, English bulldogs, pugs, and Boston terriers. These anomalies are less common in large breed dogs, and only limited cases have been reported in puppies. Congenital thoracic vertebral malformations or CTVM can result from failures in vertebral body segmentation, such as block vertebrae, or failures in formation, such as hemivertebrae, wedge-shaped vertebrae, and butterfly vertebrae. These conditions can lead to abnormal spinal angulation, including kyphosis, lordosis, or scoliosis, along with vertebral instability, spinal canal stenosis, and spinal cord compression. While some of these deformations may be incidental findings without clinical significance, others can cause neurological dysfunction, manifesting as progressive, non-painful pelvic limb ataxia, paraparesis, and even incontinence. Conservative treatment for these conditions often leads to poor outcomes. Various surgical techniques have been developed to relieve spinal cord compression and stabilize the affected area. In large breed puppies, successful surgical outcomes have been reported in only 2 cases. This study is the first of its kind to evaluate medium-term outcomes after decompression and fixation of complex thoracolumbar vertebral malformations, specifically those involving combined failures of segmentation and formation, in adult large breed dogs. This research aims to add valuable insights into the management of these conditions. Let's delve into the specifics of the study design. This was a retrospective clinical study, meaning that the researchers analyzed data from previously treated patients. The study included 3 large breed dogs diagnosed with thoracolumbar myelopathy and a radiologic diagnosis of spinal cord compression due to thoracolumbar vertebral malformation. The study aimed to assess the medium-term outcomes of surgical management by evaluating neurological examinations and follow-up imaging studies, conducted up to 12 months post-operation. The research involved a review of electronic patient records of adult dogs, older than 1 year, and weighing more than 25 kilograms. The researchers carefully documented the examination findings, diagnostic imaging, surgical procedures, and patient outcomes to evaluate the effectiveness of the surgical intervention. The dogs were all young adult, intact females between 2 and 4 years old, including a Rottweiler, a Bloodhound, and an Irish Water Spaniel. They all presented with a chronic history of progressive gait abnormalities, but showed no signs of pain. 2 of the dogs were ambulatory paraparetic with asymmetric pelvic limb ataxia, while 1 dog was non-ambulatory paraparetic. All 3 dogs were alert and responsive, with normal segmental spinal reflexes and cranial nerve function. Blood work was within normal limits in all cases. The neurological localization for all 3 dogs was in the T3, L3 spinal cord segment. The differential diagnosis included congenital malformation, infectious or inflammatory processes, degenerative conditions, and neoplasia. Now, let's examine the results of the study. The researchers identified 3 large breed dogs with progressive, non-painful T3 to L3 spinal cord segment disease. Magnetic resonance imaging, or MRI, and computed tomography, or CT, scans confirmed a single-level, complex congenital vertebral malformation with combined failures of segmentation and formation in the T8, L1 region. The surgical intervention involved ventral cord decompression through bilateral mini-hemilaminectomy and partial corpectomy, followed by vertebral fixation. Temporary postoperative neurological deterioration was observed in 2 of the cases. Follow-up examinations at 6 weeks and at 3, 6, and 12 months post-surgery showed improved neurological function, with all dogs becoming ambulatory, though with persistent mild paraparesis. Let's look at the individual cases in more detail. Case 1, a Rottweiler, had incomplete formation and segmentation of the T13 and L1 vertebral bodies. Figure 1 illustrates this, showcasing both T2-weighted MRI and CT images in sagittal and transverse planes. The images reveal the abnormal shaping of the vertebrae, leading to kyphotic deformity, vertebral canal stenosis, and spinal cord compression. Measurements of the spinal cord diameter at the cranial segment were 5 by 5 mm, decreasing to 4.5 by 3.7 mm at the site of the malformation. In this case, adjacent intervertebral disc degeneration and vertebral endplate sclerosis were noted at T12. Case 2, a bloodhound, had similar incomplete formation and segmentation of the T8 and T9 vertebral bodies, resulting in kyphoscoliosis and spinal cord compression. Figure 2 shows the MRI and CT images with the malformed vertebrae. The spinal cord diameter was 5 mm cranially, but reduced to 1.8 and 3.5 mm above T8 and T9 respectively. Case 3, an Irish Water Spaniel, had incomplete ventral formation and segmentation of the T10 and T11 vertebral bodies, creating a mushroom-shaped vertebra with adjacent intervertebral disc degeneration and protrusion. Figure 3 displays these findings through MRI and CT scans. In all cases, there was increased T2-weighted signal intensity within the spinal cord at the site of maximum compression, likely indicating edema, inflammation, or gliosis. In terms of the surgical procedure, all dogs were initially anesthetized and given prophylactic antibiotics. Analgesia was maintained using methadone and a continuous rate infusion of ketamine. The dogs were positioned in sternocumbency, and a dorsal approach was used for the surgery. The surgery included ventral spinal cord decompression via bilateral mini-hemilaminectomy and partial lateral corpectomy, followed by vertebral fixation. In case 1, pedicle screw rod fixation was performed using titanium alloy screws and interconnecting rods. In cases 2 and 3, threaded pins and bone cement were used for vertebral fixation. In case 3, a bilateral laminoplasty was performed using a titanium alloy mesh anchored to a rib head with screws and bone cement. The postoperative CT scans in all cases confirmed satisfactory ventral spinal cord decompression, and implant placement was successful, with no evidence of vertebral canal breaches. Postoperatively, the dogs were given intravenous analgesia and oral medications, including gabapentin, paracetamol, and nonsteroidal anti-inflammatory drugs. Table 1 summarizes the signalement, onset of clinical signs, neurological examination findings, and neuroanatomical localization for each case. Cases 1 and 2 experienced temporary neurological deterioration, and revision surgeries revealed and resolved compressive epidural hematomas. The hospitalization time for cases 1 and 2 were 19 and 22 days respectively, while case 3 was hospitalized for 9 days without any deterioration. All 3 dogs were discharged with restricted rest, controlled lead walks, and prescribed physiotherapy. Follow-up neurological examinations at 6 weeks, 3, 6, and 12 months showed improvement in all cases, with persistent, but improved ambulatory paraparesis and better coordination. Follow-up CT scans at 6 and 12 months showed no changes in the vertebral canal volume and the implant position. Figure 4 illustrates the postoperative CT scan for case 1 showing the partial lateral corpectomy and the placement of the pedicle body screws. Figure 5 shows the postoperative CT scan for case 2 which shows the bone removed from the left pedicle and the dorsal aspect of the vertebral body. Figure 6 illustrates the postoperative CT scan for case 3 showing the bilateral partial lateral corpectomy and the titanium mesh laminoplasty. Now, let's explore the study's discussion and implications. Congenital thoracic vertebral malformations are caused by failures in vertebral ossification centers during embryonic or fetal development. These malformations frequently result in kyphotic deformation, spinal cord compression, and vertebral canal stenosis. This study specifically examined complex combined failures of vertebral formation and segmentation, causing marked kyphosis at a single level in large breed dogs. Nonsurgical management often leads to poor outcomes, whereas surgical intervention, such as fixation with or without decompression, has been described. The current study utilized ventral cord decompression with bilateral mini-hemilaminectomy and partial lateral corpectomy, which was necessary due to ventral compression. Different fixation strategies are available including screws and plates, screws or pins and PMMA, and the choice of instrumentation depends on the surgical experience anatomical considerations, and the specific fixation needs. In this study, polyaxial pedicle screws and rods were used in one case, while threaded pins and PMMA were used in the other two cases. The temporary postoperative neurological deterioration seen in two cases was caused by epidural hematomas. While underlying coagulopathies could not be ruled out, this suggests that careful monitoring and management of hematomas post-surgery are crucial. The laminoplasty performed in the third case was to limit the risk of postoperative compression, which is a consideration for large breed dogs due to the depth of the surgical wound. While the efficacy of this is not entirely clear, it should be considered for future cases. While all dogs in this study demonstrated gradual improvement, they remained with mild ataxic gait. This incomplete recovery is common in cases of chronic spinal cord compression with irreversible damage. The retrospective nature and the small study population are significant limitations of this study. A previous study of a large breed dog treated with corpectomy and stabilization showed good long-term outcomes with persistent, mild paraparesis, and a study in brachycephalic dogs showed long-term complications in more than half of the cases. This case series indicates successful medium-term outcomes are possible when managing complex thoracolumbar vertebral malformations with myelopathy in large breed dogs. However, long-term follow-up evaluations should be considered to better assess the potential chronic complications linked to surgery. The authors declared there was no financial support for the research, authorship, and/or publication of this article. The authors also declared that no Gen AI was used in the creation of the manuscript. This study provides valuable insights into the surgical management of complex vertebral malformations in large breed dogs. The results underscore the importance of early diagnosis and appropriate surgical intervention. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.